My name is Francesca Lorenzo Severino. Unit 5. Write sentences to describe the work of the specialist in each branch of the medicine. Look at the opposite to help you. Dermatology. A dermatologist specializes in the diseases of the skin. Rheumatology. A rheumatology diagnoses and treats arthritis and other immune heredity. Traumatology. The student diagnosis and treatment of severe acute injuries in whose pediatrics. The branch of the medicine dealing with the health medical care of the infant. Obstetrics specialize in the care of the woman during pregnancy and childbirth. They also diagnose and treatment of the diseases of the family reproductive organs. Complete the table with words from A, B, and C, opposite and drawing form. Put a stress mark in front of the stress syllable in the age where the first one have been done for you. Specialize. Pediatrician. Work with children. Practice. GPS. Work in this center. Consult. Pediatrician. Consulting rooms. Essence. Neurosurgery. Assisted operation. Graduate. Giol Matthews. Medical School. Qualified. Doctors. Degree in medicine. Find preposition in C opposite that can be used to make word combination with the words in the box. They use the correct form of the words to complete the sentences. A pathology specialized in diagnosis disease from examining self-tissue. A pediatrician must enjoy working with children. Oncologist is interested in the diagnosis and treatment of cancer. A psychiatrist must be good at counseling. A neurosurgeon must be good with her and hands. Make word combination using a word from a H box. Two words can be used to look at A, B, and C opposite to help you. Consult rules. General practitioner. Group practice. Health center. Internal medicine. Surgical specialized. Unit 6. Make word combination using a word from H box. Look at A, B, and C opposite to help you. associate, specialized, house, officer, and call, precisional, diagnosis, rad- radio, radio, peer, and word, and brown, round. Master description with with the objective plot in A and B opposite to help you. Dr. Graham has been a pediatrician 8 years and is responsible treating the children admitted to work just started war 60 and consulting. C. Consulting. 2. Dr. Stewart has just started second year of the Foundation program is D. Show. 3. Dr. Shane has started his training as surgeon. Is A. Specialized register. 3. 4. Dr. Phillips has used graduate and is working in a large hospital, Birmingham. Is E. PRO or Health Officer. 5. Similar is in charge of the medical staff in the Birmingham Hospital. Is B. Medical Director. Are the following statements true or false? Find reasons for your answer in A, B, and C opposite. A medical graduate becomes registered 2 years after graduation. False. The system the system of training doctors in Britain is called the Foundation Program. Is true. The name senior house officer is no longer used in Britain. Is true. The consultant is usually the first doctor to send new patients. Is false. When working is things all doctor takes care to be one call. False. Complete the text of the PRAHO describing her job load and A, B, and C opposite to help you. When I have to go, I am when I have to they were the first I thought is that to the house office will have on you during the last war to think how if there have been any new admissions loans they had Henry said the charge nurse. It tells me if there is anything that needs to be done urgently, such as intervention to put up or take down. Later in the morning, I clerk any new patients with vesicle in number stage and history on the Tuesday and Friday morning. The consulting just the hair was enrolled round, and I have to make sure and complete of the date on her patient. After that, there are usually lots often seen to the light ring of waiting for form for blood test, and so on. The afternoon I have to the program from any patients who are to be discharged. The next day they are usually happy to be go home. And then of course there are the lecture and tutor in the foundation program on the Monday and Wednesday. Unit 7. Complete the sentences. Look at A, B, and C opposite to help you. Someone who specializes in delivering babies in midwifery. So someone who is qualified to assist nurse is a clinical support working. Someone who is not qualified but is able to assist nurse in nursing while working. A a nurse who has qualified staff nurse. A nurse who specializes in the health promotion is a health visitor. A nurse who looks after a ward in the charge nurse. A nurse who works in the company in the district nurse. Someone who answers the ward cell phone is a nursing auxiliary. Make word combination using a word of the part from H box look at D opposite to help you. Carry out our procedures. Change and add to drowsing. Check and the temperature. Give and injector. Remove is sutures. Complete the sentences with the correct grammatical form of perform. An isotope brain scan is the painless and easy to perform. Biopsy of the pancreas has been performed last March. If the patient's condition deteriorates, a laparotomy should be performed. If a diagnostic of the meniscus is suspect, a lumbar puncture must be performed. Last year we performed a randomized double-blind group study. Complete the sentence with the correct grammatical form of carry out. I know I know intend to carry out a large student are from unfortunately feel proudly control and the trace to carry out. So far, a number of the students carry out recently carried through and recently to look at these questions. Array array gynecologic were carried out and the patient's minute recovery. Some procedure can be carried out in the emergency department. Unit H. Make word combination using a word from H box look at A, B, C, and E opposite to help you. Ambulance technician artifice 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 learn glove fudge contact lens health professional intra 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 intraocular intraocular pressure pressure occupation occupational therapist social worker with allied give professional call best help to following people log and A, B, C, and E opposite to help you. A young unmarried woman who has a baby social work. A woman who is having difficulty using her brain are following a factory physiotherapist. Someone who needs glass opticum. An elderly woman who has an enveloped knee amputation. Protested occupational therapist. A man who with Alzheimer. This is social work. A man with a fungal infection of EV seropodis podiatrists. Complete the test look in A and B opposite to help you. A prostate work with patients of the age as member of clinical of a clinic, then based a large hospital. The patients may need a process as the result of the accident or amputation following a decision diabetes alternative alternatively they might have been born limb. Auditories were along the doctor's nurse, physiotherapist, and occupation therapist to give the people under their care the best possible rehabilitation. Their main aim is to enable the patients to lead a normal life, avoid illness, orthodontist of the world, a clinic as part of an outpatient service and all visitors of the center to provide a service of the people with specialist needs they live with people of the all age. For instance, children will have several parts might require spleen to help them walk, and many old people need special shoes to correct deformities. If the means any part of the human skeleton may reckon some form of the authors, the authorities may be need to repository the body or to relieving pain. Uni, Uni 9. Complete the table with word from A, B, and C opposite. Put a trace mark in front of the street syllable in each word. The first one has been done for you. Admit, admission, access, assessment, discharge, discharge, operate, operation, refer, refill, treat, treatment. Make word combination using word from H. Both look at C opposite to help you. Acutely, acutely ill. An assessment unit. And jury. Refill letter. Wearing list. Which hospital department would be most appropriate for the following patients? Look in A, B, and C opposite to help you. A woman in diabetic coma, intensive care, care unit, intensive care unit. A patient who has used a radical prostate, prostatectomy, prostatectomy, high dependency unit. A patient who is to have a key lesions removed, the surgery unit. A man view a foreign body in the A. I. Emergency. Emergency. A woman with learning aborting. Accident and emergency. Emergency. Complete strike from an information for patients. Look at A, B, and C opposite to help you. Information for outpatient. When you are in the hospital, please the receptionist will welcome you. Welcome. Check your details and direct you the white are the length or of your visit. He will depend on the treatment you're going to have. You may need to have some tests shows as accurate which could mean going to another department, or you might be referred to other professionals. You as a physiotherapist of the date, you may need to revisit the clinic if staff of the clinic want to see you again. No appointment will be right for you if you need to be admitted to hospital for more than either as an inpatient of the day. Sorry, you will be told when this is likely to happen. If you don't know, need further therefore you will be discharged to your GPS car. Unit 10. Complete the sentence. The sentence blood and A opposite to healthy. Shoulder over 60s and people with some chronic diseases do not have to pay prescriptions charged in the UK. Patients with mobile problems may be unable to go or they are housebound. The average GP appointment in the minus long and is term. A locum is someone you trust the place of a staff member who is on leave. Karate, karate working words in now has out of hours. Make word combination using a word or burns from each box. One word can be used to log and A and B opposite to healthy. Change, dressing, dressings, make, young business, home business, perform, minor minor surgery, minor surgery, refer, a patient, RAM, a clinic, supervise, staff, take, messages. Which member of the patients then will be responsible for each of the following? Look at B opposite to healthy. Running clinic for pregnant women. Midwife. Teaching a patient how to straighten is born in lane physiotherapist. Letting the GP know that a patient can come to her appointment. Receptionist. Running clinic for people who want to lose with practice nurse. Bearing a patient who have used return home after a hernia operation. District nurse. Carrying of check-ups on children in a poor neighbor health visitor. Organizing cover for an absent doctor practice manager. Complete diary for Dr. Stewart's afternoon look at A and C opposite to help you. Practice team mirroring over sandwich lunch. Afternoon. Surgery. 12 minutes of appointments. Coffee break. Check with reception for messages dealt with home. Visit and brief prescription request. Paperwork EH reference to secondary. And admin turns cell phone call on the patients. Private medical examination. Phones switch to who service. And march these activities to the stages of the medical education in the UK given E positive. Dissecting cadavers undergraduate. Can keeping a log of the cervical fractures observed in perform programs proscribed working for 4 months in accident in emergency experience the specially a foundation program taken a 4-week Tosman in obstetric and gynecology in the undergraduate taken only course on recent develop the developments in cardiovascular and disease continuing professional development. Complete the sentence. Look at B and C opposite to help you. Just before their final year, students have the chance to take an elective in a hospital of problem on the heart, choice, energy. Complete the sentence. Look at B and C opposite to help you. Just before their final years, students have the chance to take an elective in hospital of heart choice anywhere in the world. Problems based problems based learning content with a prompt where each sub is tagged separately. These day lectures are often interactive with regular opportunities for the students to ask questions. In clinical assessment, students learn how to treat and manage patients. Student selected models can be a topic from outside medicine, such as foreign language. Dissection of cadavers is an important part of the anatomic component. The medical school at the University of Edinburgh is one of the oldest in the UK. She is consulting at the Royal, one of the latest pediatric hair specialists in the country. The Royal College of the Surgeons in Edinburgh dates from 1505. We have a seminar each week where we discuss topics in a small group with word lecture. Match age of these activities to one of the components of the underground course described in B and C opposite. Julie spends 6 weeks working in a small hospital in the Himalayas and overseas elective. A group of students discuss together the positive reason for abdominal pain after meals in an obese 4 years on the mile. Problem-based. A small group of students train the pulmonary artery in cadaver dissection. Oral spent a month working in the pediatric ward of the Log Hospital. Clinical attachment. Amy learns how to take blood from on the older patients. Clinical skill. Juma chooses to study tribal medicine in his 4th year. Students selected Mayo. Complete the phrases with verbs from the box. 2 phrases can be complete in 2 different ways. Look at A and B opposite to help you. Demonstrate a competence or who to do something. Supervise a training. Be a charm. She suppose complete her training and deliver a course or a training program as teacher. Take a course or training program as students. Assess programs or competence. Match to the 2 parts of the sentences. Look at A, B, and C opposite to help you. And F, Y is a doctor. E, yes. Demonstrant is a anatomy. Match the 2 parts of the sentence. Look at A, B, and C opposite to help you. And F, Y, one is a doctor. Is D. In the first year of the foundation program. And demonstrator is anatomy teacher. Is age. Who teach, teaches deception. A clinic trainer is the consultant. F. Who provides training during periods is the period of direct clinical care. A a supervisor is a consultant. Is B. Responsible for the training program of the trainee. A medical school is part of the universe responsible for medical education. A blossom is C. A period spent as training in the hospital or general practice. A college is A. A body of the specialized responsible for deliver and delivering and assessing learning in their specialty. A fellow is a specialist. E. Who have training their life live in their specialty. Read in the full their qualifies of the doctors and surgeons at C opposite to help you. Mr. A. H. Johannes Ben M. B. C. H. B. F. R. C. S. F. R. C. S. I. Bachelor of the Medicine, Bachelor of the Surgery, Fellow of the Royal College of the Surgeons of England, Fellow of the Royal College of Surgeons of Ireland. 2. Dr. C. Doyle, BMEDSCI, DMMRCP, College, Bachelor of the Medical Sciences, Doctor of the Medicine, Member of the Royal College of the Physicians. Miss and E. English MBBS FRCS is Bachelor of the Medicine, Bachelor of the Surgery, Fellow of the Royal College of the Surgeons. Dr. E. Berryweather, BMMD FRCP, Bachelor of the Medicine, Doctor of the Medicine, Fellow of the Royal College of the Physicians. What kind of resistance might the doctor obtain look at A opposite to help you? A newly qualified Spanish doctor, provisional registration. A newly qualified Nigerian doctor, limited registration. A doctor who has sequencing uh, successfully successfully complete the first for the foundation years for regency. A Shu who has successfully completed the foundation programs and certificate of completion of the training of several specially registered posts, especially registered. Read the arguments in the world long as A, B, and C opposite to help you. Any doctors who want to work in the UK must register with the GMC, General Medical Council. Some overseas doctors must pass the blood test before they can register. Professional and linguistic assessment board. Part part of two of their tests consists of the OSCE objective objective structured clinical examination and any emergency. Remember the ABC protocol. Airways, airway, airways, breathing, airways, breathing, circulation. Before you can obtain a specialist registration, you must have an CCT certificate of completion of the training. Complete the text log at A, B, and C opposite to help you. My name is Usa and I come from Jamie. I came to the UK about 2 years ago after graduating, graduating because James in all the EEA a call only obtain a limited registration with the GMC. I fear it was very difficult for me to obtain a place on foundation program. Although as I speak good English, I have to the lab the test to you to show that I come work safely in the UK if have to give some advices to their when there is it will be that a consulting station you shoulder through the shoulder. Simply memorize a set of the phrases. It's very to really think about what you're saying to the actor and help the intonate right. As completing my year's clinical training, I have been too often full registrants, but I found it difficult to help and show posts I might chosen, especially pediatrics, as hospital new have to demonstrate their institutional candidates from the EEI Council if complete Nissan Federation here. I shop often a CCT which will allow me to broaden to specialist registration with the GMC and import stem of the brand to become a pediatrics consultant.